Okay, so Winky is, how old did you say Winky was?
About 5.
Winky is 5, and Winky is a Degu. And Degus are in the rodent family. They look like big gerbils, but they're not. They're more like the rat family. And tell me again what Winky eats?
Mostly Degu Complete, Timothy hay, and carrots.
Good. So Degu Complete is a pelleted diet, which is in here, which is very good. Do you want to take her out, Sam? We'll take a little towel. Oh, you have a towel over there. Probably one bigger towel than that, I'm thinking. Is she still active? She's very active?
Oh, yeah.
Okay. And she's eating?
Mm-hmm.
And you noticed her eyes became cloudy just in the past day or so?
Yeah.
Okay. Okay. Well, one of the things that we worry about in Degus is that they can get cataracts, and cataracts are often a sign of a bigger problem, unfortunately, in Degus, diabetes. And it's very easy to confuse cloudy eyes with, you know, something on the surface of the eye, the cornea, but this is actually inside the eye. Okay, she's running around pretty active. Yeah, you want to just take her out? He can take her out, that's fine. Yeah. Yeah, they're very, very quick. Okay. So I'm going to move her cage. Yeah, let's open the towel up. I'm going to move her cage right out of the way. There's some room. Okay, and we can just kind of wrap her up in the towel. Okay, come here, you're okay. You're going to... Oh, you turned around all the way. That was pretty fast. Okay, you're okay. You're okay. You're okay. Okay, come here. Okay. I know. Okay. Just real gentle. Okay, we're going to hide. Sometimes when we hide, whoa, we're going to hide. Okay. Oh, come back over here. Okay. Alright, I'm just going to slide her very gently over. If you hold in front of her shoulder, she can go forward. You got her? Okay. Okay. Okay, you're okay. You're okay. I want to look at her eyes. I'm going to take a little light to do that. Hi, honey. Yeah, her eyes are very, very cloudy. Okay, you're okay. Yeah, so she has cataracts in that eye. If you want to come in, you can look at the cataract. Then she has some redness in this eye, too. Okay, she actually looks like she might have a cataract and maybe even a little ulcer in that eye. So, and it's in both of her eyes. Now, her energy level is the same and her appetite is the same as always?
Yeah.
Okay. Well, it is something that we worry about, and she's a little bit older, and it is a disease, diabetes, that we see in slightly older rodents.
There's blood there.
Yeah. In her eye?
Oh, that's Q-tip. Or unless that was already...
And that's just from her tooth, I think. Yeah. No, it's just from her gum a little bit, where she bit. It's not actively bleeding. It's dry. Okay. All right. If you want to lean her forward just a little bit, lean her forward. Okay, then I can feel her belly. I'm just gently feeling her belly. Okay. All right. It's soft. And she's passing normal size droppings?
Yeah, as far as I can tell, yeah.
Okay. Has her water consumption changed in any way? Have you noticed?
I know they drink a lot more when they have diabetes.
I'm trying not to lead you into that answer, yes. I'm just wondering whether you've noticed at all any change in her water
I haven't
consumption.
really noticed. I mean, I can always hear when they're drinking. I just can't tell who's drinking.
Just lean her forward because yeah. Okay, you're fine, you're fine, you're fine, you're fine. Okay, you're fine. I just want to feel her kidneys, which is, I have to do that when she's sort of leaning forward because the kidneys fall down. There's a kidney, and that feels okay. She's got a lot of stool in here, so she is eating. She's soft, nothing feels big. Okay, you can give her a little rest. Let me listen to her heart and her lungs. She feels like, she's still a good weight. She feels like she's lost a little muscle mass on her back, and that's something that will happen with age. You're okay. Her heart sounds great.
Okay, good.
Fast, but great. Okay, let's just look at her back end and just flip her up a little bit. Okay. The other one that she lives with, 2 others, right? They're healthy.
Yeah, they seem fine.
Okay. Okay, I just gotta look down here. Okay. Alright. Let me just take a look at that eye right there, because there's a little redness in her eye. Okay, okay. Okay. So she's got some pigment changes, if you see, just at the front part of her eye. That's her third eyelid, the little red area, if you want.
Yeah.
and it's a little red just on that third eyelid. These would be what we'd call mature cataracts, like they're advanced. And I think it's going to be very important to check, she can have a break, her blood sugar, and to get some blood work on her and see. We can take some blood and we can actually run it in the hospital now and in a few minutes have a result. And if she does have diabetes, I mean, we'll have to work on her diet. It is very, very hard to treat. She will need insulin and we'll have to try to figure out a dose. And the hardest part about these guys is that unlike a person who has diabetes, who has to check their blood sugar a lot, it's impossible for you to do that, so you end up trying to check their urine. And if she lives with other Degus, you have to somehow separate them, and we'll also have to work on changing her bedding so that you can monitor how much sugar she's passing into your urine, because that's really the only way that we're going to be able to tell whether we can treat her with insulin, and it's very difficult. Unfortunately, this is something that's very common as they get older. But the first step is to take some blood work, and we want to see what's going on with her liver and her kidneys, because they're all related when you have diabetes.
Yeah.
So, okay, so we'll go ahead and do that, and we'll start with that.
Okay.